Thank you everybody for joining this little session. We're going to spend about 20 minutes just telling you a little bit about the use of voice and chatbot technologies as virtual assistants in the healthcare space. By way of introduction, as Thomas said, my name is Nate Treloar. I'm president and co-founder of a company called Orbita, based here in the US in Boston, Massachusetts. And we're a software company, a technology company, focused on helping healthcare organizations across the industry tap into the power and potential of virtual assistant technologies. So if you're familiar with chatbots, of course, that's one example. It's any kind of user experience that is conversational, allows the end user to communicate in natural language, and almost behaves like a human type of interface. And where we've gotten into this is through the success of technologies like Amazon Alexa, Google Assistant, and similar voice-first technologies, but it's certainly not limited to that. Our position with respect to these technologies is that they represent a new wave of interfaces for how users, and specifically in healthcare, how patients and clinicians can interact with digital technologies. And our interest in this is just driven by the simple fact that they are being increasingly used across all industries. I don't need to probably tell anybody on the phone here how successful chatbots have become as an alternative user interface to traditional user interfaces in web and mobile environments. But voice assistants in particular have become much more common thanks to the popularity of smart speaker devices that can be in your home or in your office and allow you to communicate with just your voice and access information, access services, play music, find out what the weather is, etc. So just some statistics here on how voice and chatbots have grown in use over the last number of years and how they're expected to grow going forward. I'm not going to read you all of these statistics, but suffice it to say that virtual assistants, which is the broad category of all these technologies, are becoming a dominant way for users to access digital experiences. So we take this reality and apply it to the world of healthcare. And before I go into that, I will point out that another way to look at how voice and conversational virtual assistants have come into the market is one of our partners, a company called Luminary Labs out of New York City, has phrased it as the 5th digital wave of disruption in digital technology. If you go back all the way to the earliest days of the web, you can count through different waves of innovation. And we're now in this new wave of innovation driven by the power of voice and conversational agents. So if you subscribe to that idea, then the impact of this next wave will and can be just as disruptive as the previous waves. We certainly believe it, or we wouldn't be doing what we're doing. Virtual assistants in healthcare. Well, more generally, virtual assistants, they do manifest in a different interfaces. Examples, like I mentioned before, are Amazon Alexa and Google Assistant, but you can also have a chatbot that runs on a tablet or on a mobile device. And fundamentally, this mechanisms for communication and interface are the same. It's a conversational interaction where you can ask a question or request a service, and the chatbot, the virtual assistant, will intelligently respond. Powering these virtual assistants are a variety of technologies that include artificial intelligence, where it's able to interpret words and phrases and be able to be intelligent based on machine learning methods on what to say back. But what I want to make clear here is that virtual assistants can appear in many different forms. What you see on the screen here are virtual assistants that run on mobile devices, on proprietary devices from companies like Amazon and Google. And in this case, the device that's second from the right on the slide is a medication dispensing device from one of our partners, a company called Pillow, P-I-L-L-O. And if you look at it, you'll see it has a screen. It actually has a microphone so you can speak to it. And it also dispenses medication in that small glass on the bottom. So this is an example of a very specialized device, still powered by voice, still powered by a virtual assistant. Now, defining a virtual assistant in a healthcare context, virtual assistants come in a number of different forms. They can be voice or chat, as I indicated, but they can also serve a specific set of features and capabilities. The most common use of the virtual assistant is simply to ask it a question. And if you own an Amazon Echo or Alexa device or any of these other voice-first smart speakers, you will have familiarity with, for example, asking it to turn the lights on or play music. But you may also ask it to answer a simple question. What is the population of London? Or what is the capital of Switzerland? Are simple examples. These question answering use cases are very common generally, but they're especially common in healthcare, because if it's a patient who's being cared for a chronic care condition, or is maybe coming out of a surgical procedure and is going through a post-acute care process, they want to be able to be supported by asking questions about their care. What are the symptoms of diabetes? How do I take a particular medication? How often should I take a particular medication? And so answers to frequently asked questions are a common use case. Also in the healthcare space, we see reminders coming up quite a lot as a virtual assistant type of capability, where the patient isn't necessarily starting the process, but is being reminded, it's time to take your medication. It's time to do your exercises. Don't forget to call the doctor. These are examples. And as you move down on the list, you'll see that a virtual assistant has a number of just templated experiences. What we do at Orbita is we've standardized these templates as recipes in our platform, and then we support the deployment of these applications across the different types of devices. The last point I'll make on this slide is a virtual assistant is not a substitute for human interaction. Obviously, it's a complement, or it augments it. So there are a number of applications where a virtual assistant is the first point of access for a patient under care, where they can ask those basic questions. And then it relaxes, or it has the option to send the patient to a call center, a live representative. We call this call center escalation, or sometimes call center deflection, depending on the perspective. And the advantage of this for many organizations, having a team of call center experts is expensive. And if you have a way for a virtual assistant to handle the common requirements, the common questions, the technology can handle most of the cases, but also relax to the other one. So I'll get to your question, Dennis, about security. That is one of the fundamental aspects of this presentation. One of the questions that just came in was trust of voice assistants, and I'll speak to that shortly. So the spectrum, and this gets to the question itself, the spectrum of use cases for virtual assistants in healthcare. The first instances of virtual assistants in healthcare were purely educational, where an individual could ask a question like, what are the symptoms of a spider bite? How do I treat a sunburn? And there are a number of applications out there that you can take advantage of in the Alexa Skills Store, for example, that do exactly that. The request that goes to the virtual assistant is anonymized. It doesn't know who's asking the question. It just knows that it's received the question and it's just going to provide an answer. So informational virtual assistants on the left side of the picture. If you move towards the right of this diagram, you're moving into more clinical applications, where in the case of assisting, it's providing guided instructions, it's maybe providing reminders, but it doesn't necessarily need to know who the individual is that's asking these questions or receiving these instructions. If you move into a place where personal information and a personalized experience become part of what you're doing, now you're moving into an area of security and privacy. And what I've highlighted down here, in the US, we have regulations under the banner of something called HIPAA, I don't remember exactly the acronym, but the point is that it's a set of regulations to define how data should be made private and secure in healthcare applications. And this is independent of any kind of virtual assistant technology, protection of and privacy of data. In the European Union, GDPR is a more generalized version of that. But the point is that there are a set of regulations and requirements for protecting data. And as you move to the right of this diagram, and you're starting to personalize the experience, you're starting to provide more data and access more data, then you need to be you are in a mode of data privacy and security, and the compliance regulations fit in. I'll get back to your, Matteo, I'll get back to your question shortly when we summarize here. So I'm going to give you a handful of examples. I alluded to this one before. A number of our customers are using us to deploy virtual assistant technologies to the platforms I mentioned, Google Assistant, Amazon, Alexa. Answer your question, Matteo, we support omni-channel publishing, so the Orbita platform supports the ability to create a virtual assistant conversational interface in one environment and publish it to Alexa, to Google Assistant, to a chatbot, to an SMS messaging service, even to an interactive voice response system that works over a traditional phone. In the case of the examples you see here, Mayo Clinic is one of our customers. They have a voice skill for Amazon Alexa that is available for public access, answers simple questions about first aid. So the example I gave before, how do you treat a spider bite? That's what the Mayo Clinic's Alexa skill supports. That same skill is also available on Google Assistant. It's also available as a chatbot on the Mayo Clinic website. But this is an example of that leftmost portion of the assistant spectrum, where it's just simple information retrieval, question answering, capabilities like that. Moving into a little more sophisticated, a number of our customers in the payer space also use virtual assistants and chatbots to support question answering related to insurance-related questions, insurance and care-related questions. So, simple example that you see here is an entire conversation with a virtual assistant that can get up to a point where the virtual assistant may not have the answer and may suggest that it should accelerate or extend the call over to a human agent. So the idea here, again, like I said before, is that it's not replacing the call center, it's augmenting the call center. Answer the simple questions, handle the simple requests, and then provide the ability to relax to a human in a call center. Let me just catch up on the questions here. So I'll give you a couple more examples and I'll get to the privacy and security questions that are coming in. This is an example of a use case in a residential or assisted living application. One of our customers, a company called Libertana, is based out in California. They are a assisted living. They have individuals who are elderly or otherwise health compromised, and they live in this assisted living facility. They have a voice service that allows them to make requests, check the schedule of activity for the facility, message their on-call care team, and generally receive support through a voice-first application. And for individuals that are under care, they may have, for one reason or another, no ability to use traditional digital technology devices like a smartphone. Maybe their vision is compromised and they can't use a smartphone or any kind of device that requires being able to look at it. A voice-first application simplifies that. And in the case of our customer and partner Libertana, they also saw some other benefits. One, most notably, is this idea of reducing social isolation, managing feelings of loneliness. In the US, at least, the Medicare system has identified isolation, social isolation, as a significant cost to the system in terms of the actual bottom line impact on health. And so that's an important one that is often misunderstood. The idea of a virtual assistant is virtual and as robotic as it might be. It's a way of at least addressing in part a feeling of social isolation. Another one is more of a clinical use case where patients under care can use a voice-powered virtual assistant to make requests to the on-call nurse. Think of it as an inpatient nursing assistant. So they can say, I'm in pain, and the nurse can, the virtual assistant can forward that request to the on-call nurse, and the nurse can respond based on the nature and type of the request. It could be, I just need a glass of water, but if they say I'm in pain, then you want to handle it very quickly. If they say I need to use the toilet, what you for sure don't want to have happen is a patient who's just come out of surgery try to go to the toilet without assistance, because if they fall, then the implications are quite serious. So this is an example of a inpatient nursing assistant that is developed by one of our partners, Deloitte. This one's called Deloitte Assist. And that device you see in the picture on the left actually mounts under the television in a patient's room. And the patient can speak to it hands-free and make these types of requests. So let's talk about privacy and security. So with virtual assistants of any kind, but particularly ones that are powered by voice, there are serious concerns and legitimate concerns related to the privacy and security of data that may be transmitted over these devices. And it takes many forms. That concern takes many forms, one of which is the technology on the back end. In this case, we'll talk about Amazon Alexa. Up until very recently in the United States, Alexa could not be used for any kind of application that transmitted protected health information. That's information about individual's health that includes some unique identifier about who that patient, that individual is. That combination could not be supported by an Alexa, at least not be supported and be in compliance with the regulations that exist in the United States, specifically HIPAA. So a little over a month ago, Amazon announced a limited availability of a version of Amazon Alexa that would be eligible for the HIPAA compliant skills. And they announced it along with 6 organizations that had developed personalized health skills based on that early version of a HIPAA compliant or HIPAA eligible Alexa. And you can see the list of a few of them here. One of them in our backyard here in Boston is Boston Children's, very much an innovator in voice-first applications in healthcare. So the reason they did this, Amazon did this, is because there are real opportunities for these hands-free virtual assistants. But with constraints of regulation, Amazon could not support these kinds of applications. I will point out that right now, this is a limited availability version of Alexa, so it's only available for invitation only. And right now, these first 6 skills are the first ones that are on the market. The actual things that Amazon did in order to support this particular version included some things that had to be done technically on the back end, but also Amazon needed to be willing to sign a business associates agreement, which is a privacy and security agreement with each one of these 6 customers to ensure that they are complying with the obligations to protect and secure the data of the individuals using that application, the patients themselves. And different requirements exist with each of these different organizations, but suffice it to say they're very strict and very rigorous in terms of the obligations that Amazon needed to sign up for. Now, there are other security considerations that go beyond just the regulatory compliance, but just by way of definition, a personalized voice skill is one that allows an individual to share information about their health to a virtual assistant that can be used to inform the conversation, what the virtual assistant says back. This very simple example is patient reporting some health data, and the virtual assistant saying, yes, I've got that, and I'm going to remind you to take your medicine. So that's a very simple example. But there are other privacy concerns, and shortly after Amazon made their announcement, a number of articles came out in the States in particular, and I think a few of them have made their way around the world, about general privacy concerns. So a hands-free voice experience that you can speak to from across the room has implications of information being shared in an open room. So one thing to be clear is that the Amazon announcement applies to to skills applications that are used in the home. They're not really intended to be used in a shared setting. So the idea here is that an individual is using them in the privacy of their own home like they would use their own telephone or cell phone. So any information that's exchanged verbally is protected by the fact that it's inside the individual's home. That does not prevent the fact that somebody else could use that same voice device, right? Anybody can speak to an Amazon Echo. So authenticating the user and making sure they are who they say they are is another problem that is not specifically addressed by this announcement. So these are other considerations. Our platform, the Orbita platform, supports authentication models that include passphrases, one-time passphrases that you speak into the virtual assistant that ensure that the person talking is who they say they are. Other issues related to how data is end up being used or potentially being used by the big companies, Amazon and Google, are fundamentally and have to be fundamentally addressed in the privacy agreements that Amazon strikes with the organizations, the hospitals, the providers, the pharmas that are creating these applications. And we're still, Amazon, I will say it's fair, still developing their models to support the broader set of use cases. But importantly, this announcement a month ago is an important first step. It's not the end, because even beyond HIPAA, around the world we have other requirements. There's high trust certification, there's Privacy Shield, and GDPR, like I mentioned. There's ISO 27001. There's a whole variety of other standards, and any one individual organization may have standards and requirements that go way beyond even GDPR. So in our business, we are a company that is in the Privacy Shield network. We are HIPAA compliant. But when we work with our clients in the pharmaceutical space or in the healthcare provider space, we are typically go through a security audit that goes way beyond what HIPAA regulations are. And with respect to the voice assistants, you have to be very careful and thoughtful of how you're implementing these. The last point I'll make on security before we wrap up is there's always a management of risk, right? And for a 30-year-old person using a voice assistant, they may be much more risk adverse than an 85-year-old single person living alone who is benefiting from a voice assistant that is their companion. So your tolerance for risk is different. You still need to be compliant with regulations as a provider of these applications, but understand that the tolerance for risk on the part of a patient or an individual is highly variable. So I'm going to stop. I think I've used up a good chunk of the time here. Just to summarize, voice assistant technologies are emerging and becoming a much more common way for serving as the front door digital healthcare versus traditional digital health experiences. Orbita, our business, is in the space of helping our clients design, build, manage, and optimize AI-driven voice and chatbot applications. And we're delighted to discuss the opportunities to work with any of you on the phone or on the call here. I think I will pause and see if there's any questions I can answer. I will go back through the stream and see if there's some that I can address directly. If you have directly in here.
Yeah, Nate, thank you very much. Yeah, I'm checking as well the chats, and I believe you addressed on the run already everything, I believe. But let me check. Like, yeah, Alisa, she wants to know like who is using these services, a gender. You covered some. I believe it depends on what customers. But you showed a very interesting examples about elderly care, for example, as well. No. So,
yeah. Well, I think Matteo had a couple of questions. I think I addressed it, Matteo, about platform support. There are a number of different virtual assistant type of platforms. I've mentioned a few of them: Amazon Alexa, Google Assistant. Samsung has recently has made a big push around their Bixby voice assistant technology. They had a developer conference just a couple of weeks ago that had a number of new announcements. Where we sit in the technology ecosystem is we live at a level above these core platforms. We don't make a device. We don't develop a lot of the low-level natural language processing technologies. We are more of an experience management platform, which is designed for both developers as well as non-technical people to manage a voice assistant experience. Think of it like a website. In the early days of the web, you had a choice. You could either hire a teenager who knew how to write some HTML and have them build your website and maintain it, but eventually you're going to realize that's not scalable. And you need somebody who can manage the content that doesn't necessarily know web development or HTML, a non-technical person, but a content and experience manager. That's what we do for voice and virtual assistants.
Okay. Yeah, we are already out of time. We are heading to our very last session. But yeah, if you have any questions or comments or want to get more information, you just share the information. More than happy if you connect directly with Nate, all our healthcare folks as well. And yeah, I think it's very impressive what you're doing. And yes, there is definitely a big market opportunity as well, what we are seeing in the voice and AI apps, chatbot space. So yeah, thanks again for being with us, Nate. Wishing you all the best. Thank you, Thomas. Yeah, and talk to you soon again. And
take care.
You too. Thanks. Bye, Nate. And
goodbye.
Bye.